Naloxone is a fast-acting drug used to temporarily reverse the effects of an opioid overdose. Primary care physicians and their clinic teams, and community pharmacists and their pharmacy teams all have a role to play in supporting the distribution of Naloxone kits in the community. The Primary Care Pharmacy Partnerships for Naloxone Kit Distribution Pathway and Toolkit was developed by the Edmonton's own Opioid Response Initiative to support you in providing this care. As part of the Provincial Primary Healthcare Opioid Response Initiative, you can access a copy of the pathway and tools presented in this video at actt.albertadoctors.org. The Pathway and Toolkit provide guidance for primary care clinicians and community pharmacy teams in supporting the distribution of Naloxone kits to patients and their friends or family. It follows a step-by-step process and includes helpful resources and considerations. When a patient using opioids, a patient using a non-opioid substance that may be contaminated with opioids, or a friend or family member of someone using opioids has been identified by a primary care provider or identified themselves, it is important to ensure a non-judgmental and supportive approach when discussing Naloxone kits. Resources on reducing stigma and using inclusive language are included in the Pathway and Toolkit document. For patients using opioids, it is important to explore the patient's use of opioids to assess whether they are using a prescription opioid or not. The toolkit includes helpful screening tools to identify opioid misuse and screening tools for other substance use concerns. Regardless of a patient's situation, ask if they have received a Naloxone kit in the past. If they have, encourage them to check the expiry date, as kits need to be replaced after 2 years, even if they've not been used. Additionally, if the patient has previously received a Naloxone kit and it was used to respond to an overdose event, assist them to complete the Alberta Health Services Naloxone Kit Usage Survey, which is provided in the toolkit. Patients may require some education about overdose risk factors in order to help them decide if they would like a Naloxone kit. If the patient is interested in receiving a Naloxone kit, the toolkit includes resources to support this discussion, as well as a patient handout about naloxone. If a patient is not interested in receiving a kit at this time, it is important to provide alternate resources specific to their situation. Remember to revisit this conversation at subsequent appointments. A naloxone kit can be added to a patient's prescription, or a request to dispense at the pharmacy can be added to any area for comments. Naloxone kits are frequently dispensed at pharmacies, but are available at other sites in the community as well. If your clinic is interested in becoming a distribution site, visit the Alberta Health Services Community-Based Naloxone Program to register and access clinician training. Patients are encouraged to select their preferred pharmacy if they have one. If a pharmacy is not a registered distribution site, the pharmacy can visit the Alberta Pharmacists Association website to register and access training for the pharmacy team. The Alberta College of Pharmacy Guidelines for Assessment and Monitoring of Individuals Using Opioid Medication state that pharmacists must complete a thorough assessment of each individual who is prescribed opioid medications or sold an exempted codeine product. Pharmacists must document details of the assessment in the patient record of care and develop a written treatment plan for individuals using long-term opioid therapy or for those determined to be at high risk of misuse or addiction. Pharmacists or team members should inquire if the patient has previously received or used a naloxone kit. If they have, assist them to complete the AHS Naloxone Kit Usage Survey and remind them to check the expiry date on their kit. The Alberta College of Pharmacy Guidelines for providing naloxone as an unscheduled drug also state that pharmacy team members must respect the autonomy, privacy, and dignity of anyone requesting naloxone. When naloxone is provided to an individual for the first time, a trained pharmacy team member should make every effort to start a dialogue with that person. You may also consider providing an intranasal naloxone kit if available, as some individuals may have coverage for this option. We hope you will find that the Primary Care Pharmacy Partnerships for Naloxone Kit Distribution Pathway and Toolkit provides helpful guidance and tools to support primary care and pharmacy teams in distributing this life-saving therapy. You can access a copy of the pathway and tools presented in this video at actt.albertadoctors.org under Opioid Response and Shared Zone Tools.